Hello everyone, welcome to my channel Dr. Nasreen Academy. In the previous video मैंने anal fissure के introduction, उसके causes, pathogenesis के बारे में बताया था. And in this video I'll be talking about only the treatment part of anal fissure. So here again anal fissure is defined as a longitudinal split in the anoderm, distal anal canal which extend from the anal verge proximally towards but not beyond the dentate line. So for the revision, I am telling again the definition. As far as treatment is concerned, so after confirmation of diagnosis with exclusion of secondary causes of anal ulceration, I have already told the secondary causes of fissure in ano are Crohn's disease, ulcerative colitis, syphilis, tuberculosis, leukemia, cancer, HIV, etc. So, with exclusion of secondary causes of anal ulceration, conservative management should result in the healing of almost all acute and majority of chronic fissures. So, posterior and anterior anal fissure are put for conservative or operative management. Conservative management. Conservative initially, it is consisting of stool bulking agents and softeners and chemical agents in the form of ointment designed to relax the anal sphincter and improve blood flow. Conservative treatment, it is after emphasis must be placed on normalization of bowel habits such as the passage of stool is less traumatic, the addition of fiber to the diet to bulk up the stool softeners and adequate water intake are simple and helpful measures. Warm water baths or sitz bath and topical local anesthetic agents to relieve pain. However, providing patients with anal dilators is usually associated with low compliance and consequently little effect. The mainstay of current conservative management is the topical application of pharmacological agents that relax the internal sphincter. Most commonly, nitric oxide are used. By reducing spasm, pain is relieved, and increased vascular perfusion promotes healing. So that's how the application of ointments, the application of pharmacological agents work, by reducing spasm, by reducing pain, and by increasing the vascular perfusion, which further promotes healing of the anal fissure. Next is operative treatment. Surgery is indicated if above mentioned conservative treatment fails. So surgery is consisting of lateral internal sphincterotomy or anal advancement flap. Next is lateral anal sphincterotomy. In this operation, the internal sphincter is divided away from the fissure itself, usually either in the right or the left lateral position. So the figure here shows that the internal sphincter is being divided with the help of artery forceps from the fissure itself, right? The procedure can be carried out using an open or a closed method under local, regional or general anesthesia and with the patient in the lithotomy or prone jackknife position. The distal internal sphincter is palpated with a bivalve speculum at the intersphincteric groove and then the dissection is followed. In the closed method, a small longitudinal incision is made over left or right position and the submucosal and intersphincteric planes are carefully developed to allow precise division of the internal sphincter with a knife or scissor to the level of the apex of the fissure. The wound is then closed with absorbable suture. So, in the closed method, what we do is a small longitudinal incision is made over left or right position and the submucosal and intersphincteric planes are carefully developed to allow precise division of the internal sphincter with the help of knife or scissor to the level of apex of the fissure, and the wound is then closed with absorbable suture. Alternatively, either plane can be entered using a scalpel. Usually number 11 blade is used, with the blade advanced parallel to the sphincter and then rotated such that the sharp edge faces the internal sphincter, which can then be divided along its distal third. Next treatment option or modality available is anal advancement flap. After excision of the edges of fissure and if necessary its base overlying the internal sphincter, an inverted house-shaped flap of perianal skin is carefully mobilized on its blood supply and advanced without tension to cover the fissure and then sutured with interrupted absorbable suture. Why anal advancement flap is chosen? Because due to the recognition of the risk of the continence following internal sphincterotomy has led some to advocate a different approach, especially in women and those with normal or low resting anal procedure developed from the treatment of anal stenosis. So, because of these reasons, anal advancement flap is being chosen. So, to conclude the treatment of anal fissure, there is conservative treatment wherein stool softeners and stool bulking agent along with sitz bath is used, and ointments are pharmacological agents. Ointments are used to relieve pain, spasm of acute or chronic fissure. And in case of operative treatment, there are two operative available treatment, that is lateral anal sphincterotomy, which is nowadays not usually performed because of the due to the risk of incontinence or risk of more dissection of the sphincters. And next is anal advancement flap. Thank you for watching my video. Don't forget to like, share and subscribe the video. Thank you.